So our next speaker is Rosie Jackson. So Rosie is a postgrad student and researcher in the Department of Medicine, and she's also been integrally involved in the organisation of this symposium today. So after completing her Masters in Dietetics, she began her doctoral research on the DREAM study, which is a study that I was involved in as well, and was truly a dream study around sleep. It was a crossover trial exploring how mild sleep deprivation affects children's health, behaviours and well-being. And I will say that Rosie has also taken a huge interest in biostatistics. She's becoming a very good biostatistician, and last week she actually won the postgraduate Biostats Award at the Biostats New Zealand Statistics Conference. So congratulations, Rosie.
Thank you, Barbara. So I'll just move on. Here we go. So I'd just like to say that, yes, I did win the award for Biostats, but that was about the study design and being part of a team who create amazing research that are really impactful. So I'd like to talk to you today about sleep and nutrition. And I've put a new narrative for child health, but really we've been talking about how sleep is important for children's health for a while now. But this is probably a different angle you might not have heard of before. And hopefully over the next few years we'll be able to make a real difference. So the reason that we're even discussing sleep and diet is from a fair amount of observational research, some very strong observational research, we've found that children who sleep for less have a higher risk of obesity. Some meta-analyses have shown that children who have a short sleep duration could be around 2 times more likely to develop obesity. But we don't really know why this is. We think that maybe it's to do with this energy balance situation. So does sleep impact children's food intake, or is it, on the other hand, sleep impacting children's physical activity? Are they less active when they are tired? So we wanted to find out what happens to kids when they are sleep deprived. So what do? We deprived them of sleep. So we created the DREAM study, which is the Daily Rest, Eating and Activity Monitoring Study, which is a randomised crossover trial. And we wanted to recruit 110 participants from Dunedin, aged 8 to 12. And just to note that we only wanted to recruit healthy sleepers for the study so that we weren't causing any harm. So this is the randomised crossover trial. So the first week they completed a baseline week. The next week we randomised them, and then we randomised them to either receive the sleep restriction intervention, where they went to bed 1 hour later each night for 7 nights, or the sleep extension intervention, where they went to bed 1 hour earlier each night for 7 nights. After that week, they then spent a week going back to their baseline sleep schedule, so we got them to go back to that, and then they completed the opposite intervention. And the reason we do that washout is so that that first week of intervention doesn't impact the second. So during the week, we measured several different outcomes, including well-being and eating behaviour from questionnaires. We did 2 diet recalls in both intervention weeks and a feeding experiment at the end of each week. We got the kids to wear cameras for 2 days of each week, very similar to what Louise has been talking about. And this was to measure their screen time, but also to help with those diet recalls. So the kids watched the videos and could pick up on any foods that were missing in those recalls. And we also measured physical activity and sleep using an accelerometer or an Edgar, similar to a Fitbit. So I'll start off with physical activity. What happened to kids' physical activity levels when they were sleep deprived? Well, firstly, we were actually able to change these kids' sleep. In the week of sleep restriction, the kids on average slept about 40 minutes less per night, and the 48 minutes there is because their sleep became more efficient. I won't go into too much detail, but basically they had 48.8 minutes extra per day in the week where they were sleep deprived to do other activities. So what did they do? Well, they spent 19 minutes in light physical activity, they spent 22 minutes in sedentary behaviour, and they did very little moderate to vigorous physical activity. So when they were sleep deprived, they were both more sedentary and a little bit more active. But when we expressed this as a proportion of their wake time, we saw 0 difference in their sedentary behaviour, light physical activity, and moderate to vigorous. So it looks like when kids are sleep deprived, their physical activity patterns and sedentary behaviour doesn't really change. So what about diet? What happens to kids' diets when they're sleep deprived? I've just put this up there. This is a 24-hour recall, and this is what we use to collect the data. So it has a heap of detail around the brand, the amount and the leftovers. And just to realise that we're trying to pick up really small differences in energy intake for this study. And so we had to be really precise about how we measured this. So what we found that in the week where the kids were sleep deprived, they did actually eat more, they consumed more kilojoules. So in our full sample, so everyone that completed the study, which was 100 kids, they consumed an extra 233 kilojoules per day. And then in the kids that achieved our per protocol difference, which we defined as those kids who had a difference of at least 30 minutes per night, these kids had a mean difference of 361 kilojoules. So they're consuming more in the week where they were sleep deprived. Just to put this into perspective, so 300 kilojoules of energy per day, 1 or 2 biscuits, frozen pizza per week, 52 frozen pizzas over a whole year, that is definitely a clinically significant amount that could be impacting their weight and potentially explaining that relationship between sleep and obesity. Remembering that this was only 40 minutes of sleep difference per night. We also found that the types of foods they were eating changed. So the kids were eating 500 kilojoules more of ultra-processed foods. So these are the foods that have ingredients in them that may indicate a higher level of processing. And they were consuming more sugar-sweetened beverages. So that 160 kilojoules is about the equivalent of 90 mils of Coke extra per day. So we now are pretty convinced that sleep is impacting our children's diets. What's next though? And I guess the obvious solution is let's go out and improve kids' sleep. But first we have to look at how we do that. And one of those things is our recommendations. But when we looked at the recommendations, we realised they weren't based on much evidence at all, at least some of them, and in particular these 3. So these are some of the recommendations that are international, but also in New Zealand. So avoid having your child eat a meal within the hour or 2 before going to sleep, avoid screen use, and avoid active games in that hour before bed. But as I said, there isn't a lot of evidence for it yet. So our next step is to kind of figure that out, but we actually wanted to know whether our kids are even doing this to begin with. Are these recommendations relevant? Are our kids eating in the hour before bed? So we looked at the bed study data, which was an observational study looking at screen time, sleep and well-being, but they also took diet recalls as well. So we used this camera data, diet recalls to figure out what they were eating, what exercise they were doing and what screens they were on in the hour or 2 before bed. So we found that we haven't fully analysed this data yet, but preliminary results show that the kids were actually eating large amounts of food in the hour or 2 before bed. 52% of the participants had a meal in the 2 hours before bed and 82 participants had a snack. And these foods, just anecdotally from coding them, are not, your fruit and vegetables. They tend to be your chocolate, ice creams, chips, energy-dense foods. So I'm really excited to find the results, but actually it's probably not going to be that exciting as such. And we also found that they were consuming a lot of caffeine. So 42% of the participants had caffeine in the hour or 2 before bed. And we also want to know about sugar and really understand how these eating behaviours are impacting sleep. But to really find out exactly how our recommendations are impacting our children's sleep, we're going to have to do another crossover trial, woohoo! So this one's a little bit more complicated, where we're going to ask kids not to watch screens, not to eat, and not to do physical activity in the hour before bed, and then compare it to when they do. To see exactly how each of these recommendations impact sleep and to see whether we should actually be keeping them or coming up with some other options. So our next sleep research, this is what we want to do in the future. This is what we're looking forward to. Finding out whether our sleep recommendations are fit for purpose. Do we actually need to change our environment to make it easier for our kids to sleep? And one that's quite close to my heart is making sure that GPs, dietitians and other health professionals have access to this information, to this research, and also resources to help families in whānau achieve better sleep. And we've got to make sure that these recommendations are appropriate for all cultures and people in Aotearoa. And lastly, I'd just like to say we need to talk about sleep more. Sleep is just as important as diet, physical activity, mental health, well-being. We need to start prioritising it, and I'm hoping I've convinced you all of that today. Thank you.
Thank you, Rosie, and that's a great message to finish on, absolutely, since I'm a sleep person. Question? Yeah. Oh, so, Kim?
Rosie. Oh, thank you, Rosie. That was great to listen to. I was just wondering, did you collect any qualitative data about the difficulties that the parents had when it came to changing the sleep schedule for the kids, especially given that they had just a week to make the differences?
Yeah, we didn't analyse any official qualitative data, but we did do interviews with parents, and anecdotally they came up. They did say that it was very individual. Some families found it really easy to do the sleep restriction week, and others, kids like broke down over that week, and we had to kind of reduce the amount of restriction they had. But overall, the restriction week was actually not too hard for them. It was extension sleep that sometimes they found a bit harder. But I mean, it's not that much sleep. Yeah, the parents did struggle with probably the outcomes. You know, their child being a bit grumpy the next day and things like that.
Any more questions? Sheila? The question was, did we have a measure of how chaotic the household was? I think that with the conversations and interviews with parents, that was definitely something that came out, but also we have this camera data. And so I think although it is still images, we still get an idea of what their lives are like during the week of sleep restriction as well, yeah. No, we didn't do it. We didn't do a specific question on chaoticness, but we did do questions on child well-being that were really interesting, that came out with some good stuff as well. One from Elsa.
Congratulations, but I would just like to know how many children did not respond at all?
How many kids didn't respond at all? Well, do you mean didn't respond to the sleep intervention or the outcomes?
The sleep intervention.
So we had those 59 kids that managed to achieve our per protocol analysis, so they achieved at least a 30-minute difference. We may have had more kids that achieved that, but there was a few kids that we didn't have accelerometry data for. So I don't know the exact numbers that didn't do any of the intervention at all.
I just wonder that, you know, there may be a subset of the population that simply do not respond.
Yeah, definitely. And I think there's another part of my project was looking at eating behaviours, and we found that by weight status, that the children responded very differently in their behaviour to sleep deprivation. Some responded by undereating, emotionally undereating, and others responded through other eating behaviours as well.